Well, good morning and welcome to Grace St. Luke's Church in Memphis, Tennessee. For those of you joining us online, I'm Ollie Rencher, and I'm here in Tresvant Hall with several others who are here to welcome Dr. Scott Morris to talk about Church Health and our partnership with them. Church Health is celebrating 35 years. September 2022 was the 35th anniversary, and we have had a long-standing relationship with them. And then we here at Grace St. Luke's, our food pantry has partnered with Church Health in a really beautiful way with several cook teams and others that are making that possible. And it's really, really outstanding to see that unfold. Dr. Scott is a long friend of the parish and has given a lot of service and commitment in our community. And so without further ado, please welcome Dr. Scott Morris.
Oh, sorry. So I forgot that I had a mic. We all have heard the expression, getting old's not for sissies. We all know that. Some of you understand this concept, but this is my best thing I've ever heard in that same vein, is getting old is like frying bacon in the nude. You know you're going to get burned, you just don't know where. Yeah. So hopefully I'm getting past that. Well, he's right. Church Health has been open for 35 and a half years now. I came to Memphis in 1985 to start Church Health. Some of you know this story well. I'm not going to dwell on it, but for those of you who don't, I grew up in Atlanta. I was always interested in church, but for me, the thought of preaching 52 sermons a year sent shivers down my spine. It still does. I have no idea how you do that. But I read the Bible.
I share it with others.
You share it. Episcopalians got that down. Methodist, Baptist, they want to preach every Sunday. Episcopalians, they got it, and they're masters of like 7-minute sermons. Never go to a Methodist church home. All right, so I grew up in Atlanta, into the church. I read the Bible, believe it or not, I read the Bible. And I kind of realized that a third of the Bible has to do with healing the sick. It is literally on every page. But I look around to see what churches do, and there's just not much to it. We pray for people on Sunday morning. The pastor visits people in the hospital. A few people visit people in the shut-ins, but that pretty much defines our healing ministry. All over this country, we have built large hospitals that have church names on them. They do good work, but they have almost nothing to do with worship and congregations. It seemed to me that there ought to be more to it than that. So I go to college, I go to seminary. I spend most of my time in seminary looking at what the church has historically done. And I come to realize there's a reason these hospitals have church names on them. We just forgot. I mean, who in Memphis could tell you why Baptist or Methodist are named Baptist or Methodist, or even more, St. Francis, a for-profit hospital named after St. Francis. It's a little hard to get your head around. Anyway, so I set out to figure this out. So I spend most of my time in seminary coming to realize there's a reason these hospitals have church names on them. We just forgot. And I'm not going to spend my whole time talking about this. I'm happy to talk to you about it anytime if you want to hear more about that. But anyway, I come to realize that in America, prior to the Civil War, if you were sick, the most likely person anybody would see for health care was actually a pastor. Pastors provided virtually all the health care there was in America. 2 examples, Cotton Mather, who you may think of as a hellfire and brimstone preacher in the colonial period, preached the sermon, Sinners in the Hands of an Angry God. That's a 2-hour sermon. Episcopalians did not like that. And then the theology is a little wacko. But then the person near and dear to my heart, so Cotton Mather actually initiates the notion of inoculation. Inoculate successfully the entire city of Boston against smallpox is considered by most medical historians to be the first significant figure in American medicine. The reason that we have a vaccine for COVID right now, you can trace directly to Cotton Mather. Now, the person who's near and dear to my heart, and I hope to yours, is John Wesley. So Wesley the founder of the Methodist Church, Episcopal priest, Church of England priest, never leaves the church, but thinks of himself as a physician from the day he was 19 until he died. He wrote several books on healthcare. His book, Primitive Physics, which is a self-help healthcare manual, is so successful in the American frontier that as late as 1850, if we were in Memphis in 1850, there would have been a greater chance of you having a copy of Wesley's book, Primitive Physics, than you would your own copy of the Bible. Now, I admit Wesley had some unusual ideas. He had at least 18 different cures for baldness. I've shared most of them with Holly, and he just seems to have no interest. My favorite is you take a big red onion, you rub it on your head until it turns red, then you put honey on it. And if that doesn't work, you could use Wesley's tried and true method for anything, which is you can electrify it. Wesley actually saw a demonstration of static electricity that was put on by Benjamin Franklin in London, and was so enamored with the idea that he went home and in his garage, he created a little thing he called an electrifier. And if you read his diaries, he used it virtually every day. But look, it's not as crazy as it sounds. Somebody falls down dead right here. You want us to put electricity through your heart, I think. And in general, and this is ultimately where I'm getting to about bringing this in, is, our bodies are more electrical systems than they are chemical equations. Yet we have come to believe that chemicals, drugs, can solve all our problems. But if you look at your heart, primarily electrical, your brain, electrical, your muscles, electrical, why would we think that drugs can fix problems with those parts of our bodies? Why do we think that? It's like if the lights are flickering in here, that you call the plumber. You wouldn't do that. And in many ways around our bodies, we need to better understand our bodies. And it's not just about the drugs. All drugs are poisons. Now look, I'm a statin prescribing doctor. I prescribe statins every day. But, the drugs don't work. They just don't do everything they tell you they would do on TV. If they did, doctors would be killing people right and left. The reality is we were already doing that. So we have to find other ways to actually engage our bodies and what it means to be healthy. I promise you I'm getting there. So this is how I spend my time in the seminary. And then one day, I was in the chaplain's office at the Yale Medical School, and I look on his desk, and there's a little pamphlet that says how to start a church-based health clinic. And I go, that's it. That's what I want to do. I've written my Lutheran pastor. I come to meet him and others. Come to realize there's a lot of people who care about faith and health, not just me. And then I meet them, and over the next few years, I finish seminary, medical school, do a residency to be a family doctor. I'm ready to start my own church-based health clinic. I don't want to go back to the South. I don't want to go back to Atlanta. I want to stay in the South. And then one day, not making this up, I read somewhere that Memphis is the poorest major city in America. And based on that, I say I'm going to Memphis. At this point, I was 33 years old. I was too young, too dumb, to realize that what I wanted to do had no chance to succeed. I came to Memphis just totally selling out an empty cart, knocking on doors, coming to Grace St. Luke's. Why would y'all want to support this other than what I had behind me was the full weight of the gospel. In the New Testament, Luke and Acts, written by the same guy, in Luke, he's telling the story of Jesus, which is to do three things: to preach, to teach, and to heal. That's what you're supposed to do if you want to follow Jesus. And yet, how do we engage that? So you're supposed to do what Jesus does. So in Luke, there are 17 recorded acts of healing that Jesus does. Acts is about trying to tell the story of how do you follow Jesus? What would it look like? So you do three things. You preach, you teach, and you heal. That's what Jesus does in Luke. And then we hear the same story again in Acts. Now at this point, we have 19 recorded acts of healing in Acts that the disciples did. not Jesus. Sorry, y'all, I've been really dry for a while. I don't know why. Anyway, so in the book of Acts, he tells a story about following Jesus in two ways. That of Peter and Paul, two very, very different personalities. But they're both expected to do the same thing. You know, they preach, they teach, and they heal. Now, the healing part, he takes really seriously, because the other thing that Jesus does in Luke is he raises people from the dead. So he makes the argument that if you want to be a leader of the church, you better be able to raise people from the dead. So my entire favorite story in the gospel is Paul is preaching to this crowd like this, only it's crowded, people are hanging out the windows, it's open, a young guy's sitting there, and then he falls asleep. He falls out of the window and he's dead. So it's now incumbent on Paul to raise him from the dead. So I don't think you're going to need this without me, but if you ever get to where he or any priest you have here is just preaching too long, you just need to go ask him, are you prepared to raise people from the dead? All right, so moving on. How does the church go from the end of the gospel, when there's only a handful of Christians, that's all there are, to by the time of Constantine, the writings on the wall and Christianity is going to become the state religion of Rome. That's not because Constantine saw this in his own heart, it's because he saw politically how it made sense. So what happens between the end of the gospel and the beginning of the 4th century? So a lot of people would tell you that the only way the church grew had to do because of healing. Had to do because of preaching. Only preaching had almost nothing to do with it. What it had to do with was healing. In the 2nd and 3rd century, there are plagues all over the Roman world. And when people get sick, they are only cared for by the Christians. And when they get better, they ask the question, who is your God that I might worship him? That is what grows the church. Engaged in a healing ministry is ultimately about evangelism. And in today's world, what if we embrace that ourselves? You know, what would a healing ministry look like in today's world? I'll come back to that in just a minute. So, I ultimately come to Memphis in 1987. We opened our doors September 1st, and we began a ministry to focus on providing health care for the people who work to make our lives comfortable. You know, we're going to use the resources of the church, that's the plan. And if you're going to do that, you should go where the need is greatest. So in 1987, there were 26 million uninsured Americans, almost all of them working in low-wage jobs. So that became our niche. You know, we take care of the people who work to make our lives comfortable. They cook our food, take care of our children, wash our dishes, cut our grass. Well, when they dig your grave, they don't complain. Yet when they get sick, their options are very few. So we saw 12 people the first day we were open, that's it. It's the fewest we've ever seen. And since then, there are now 80,000 people in Memphis who depend on church health for their health care. 80,000, that's a big number. Almost all working in low-wage jobs. So how do we do this? You know, it's 35-year history I'm just skipping over here. But we started in this little house on the corner of Peabody and Bellevue, just down the street. Over the years, many people came here thinking this was church health, because you're on the corner of almost the same thing. So that becomes our niche and starts just with me. We end up growing to where we have 20 providers. We run a family medicine residency in partnership with Baptist. And then we have 1,000 patients, 1,000 physicians who are volunteering to see patients for us. So how does that work? So I'm a family physician. Somebody needs a cardiologist or an orthopedist. They need surgery. Well, we have an arrangement with all the hospitals. As long as the physician donates his or her time, we can admit people free of charge. There's not a problem somebody could have from the cradle to the grave we can't take care of. It's a small miracle. It's what some people refer to as church health magic, only it's not magic. It's a reflection of what happens when people are willing to set aside their differences and say, how can we do this together? So, it's very complicated. Trying to organize 1,000 doctors and not make anybody mad. You want that job? But it works. It works. And we ended up moving to Crosstown Concourse in 2017. So, we begin in this little house. How do we get to Crosstown? So on July 8th, 2011, almost 12 years ago now, a young art historian comes to talk to me about his idea of how we can work together to renovate Crosstown, which used to be a Sears distribution center, and turn it into an artist colony. It's a financially viable idea, isn't it? No, that is not a financially viable idea. All they want is for church health to be their doctors once they move in there. So what they didn't know is that we had grown into 13 buildings and become very inefficient. And so what I say to them in 2011 is, well, what if we move in there with you? So I married one crazy idea with another crazy idea. And then for the next 3.5 years, we become developers until where we ultimately get to is we have to raise $300 million to do this renovation. There are 48 financial institutions in place. It's a wonder to behold. It's ultimately what's possible in God's imagination. But we get started in 2017, and we're going strong, and we're really at a point right now where how do we take this to the next level? And what I want to talk about now is what I think might be one of our best ideas we've had, because church health is fundamentally about the church. We're not here to solve the great social problems in America. We actually don't know how to do that. We're not trying to do that. We're trying to figure out how do you call people of faith together, Jewish, Christian, Muslim, Hindu, I don't care, to say how do we care for our bodies as well as our spirits, and how do you care for the poor when they're sick? That is our niche. So in doing this, church health is not a federally funded anything. The government cannot do the work of the church, and neither should we ask it to. Ollie, how much federal funding do y'all get from Grace School? Nothing? I mean, that's an absurd question to ask, right? The government's not going to do the work of the church, but what we are called to do is figure out, how do you follow Jesus? Which means we preach, we teach, and we heal. So what does a healing ministry look like? So yes, a big part of what church health does is directly taking care of poor people when they're sick. We're a real doctor's office. Every day we take care of people who are on the verge of dying. And in doing that, we believe that the church should always offer the best, which is why I need your help to go and recruit doctors who are members of Grace St. Luke's, nurses, dentists, whatever. This is the way that they can give back. We'll make it incredibly easy for them. But how does the church, in a bigger sense, engage this type of healing ministry? So, to really understand church health, you have to understand our view of health. So being healthy is not about the absence of disease. The World Health Organization would agree with that. Who cares if you live 2 years longer? It means 2 years longer in a nursing home. Life for life's sake can't possibly be the point. Breathing in, breathing out, none of us are signing up for that. So what we think being healthy is about is ultimately 3 things. Having more joy in your life, having more love in your life, and being driven closer to God. If those things aren't happening, then what is the point? I tell this to you right now. If what you're doing in your life is not bringing you more joy, more love, and driving you closer to God, then you need to stop. You need to regroup and figure out, what am I going to do now? Now, if that's what it takes to be healthy, joy, love, God, it doesn't have a lot to do with the doctor, does it? Which led us to create something we call the model for healthy living. So sadly, we're having internet problems, but we're able to at least get this up here. So what is the practical implications of joy, love, and God? So we have developed something we call the model for healthy living. So we will argue there are 7 things in life that are equally important to life if you're going to be healthy. They're all equally important. They have to be in balance. No one is more important than the other. So, medical care is one, but it's only one. Only 10% of your health outcomes have anything to do with what the doctor would do. 10%. That's it. We spend over $1 trillion a year in this country on doctors, hospitals, and drugs, and yet it has only a 10% outcome for us to be healthier. I think you could argue we're not spending money very wisely. All right. The second is nutrition. I'm going to come back and talk about that. The third is movement. Our bodies are made to move. Emotions, family and friends, work. You find work as those things that bring meaning to your life. And lastly, your faith life. Your faith life is as important as anything a doctor would do if you're going to be healthy. So, the model for healthy living, which is this round circle. If you're ever at Church Health, you'll see this everywhere you turn. In your own life, rate yourself 1 to 10 to see how you're doing in each of these 7 things. Put a dot there. Connect the dots. And ultimately, by connecting the dots, you want a circle that rolls. For most of us, our circle is very lumpy, bumpy, or the circle is really small. You want a big circle. How does it work for you? So within Church Health, we engage health coaches to help figure this out for all of our patients. It's rare that the answer is this patient needs more drugs. If they need more drugs, we'll get them more drugs, but that's rarely the answer. So, nutrition. Your mother told you you are what you eat. She was right. If you've been to our nutrition center, and I know a bunch of people in the food pantry have been there a lot, we do 3 things in there right now. One, we're big believers in what's known as culinary medicine. Food is medicine. Now, how do you engage patients and all of us in that mindset? Well, it's not easy, but there's a lot we can handle. So we teach young doctors, every type of health professional you can imagine, how to engage people around food to be healthier. Now, the second thing we do there is we can teach patients healthy cooking habits where they can be there for an hour, and then in that course of an hour, you cook a healthy meal. We explain to them it's actually possible to eat healthy without just having to spend everything you have. It is. So there's nothing we cook there. We don't engage people around the cost. And then the third thing has to do with getting people like you in our kitchen and over the course of 2 hours to cook a meal that we then will freeze, and then we distribute those meals to our patients that we believe are food insecure. And this has been a great home run, I think, and the issue here is how do we grow it? That is what I'm proposing to y'all and what your leaders of your food pantry are wanting to engage with. So what would this look like? So think about Meals on Wheels, which is a fabulous thing. We want to do that. That is delivering hot meals. MIFA has that down. The food bank is really good about distributing food that is uncooked in a grocery sack, all well and good. But is there a way to cook and deliver frozen food to a much bigger audience? Now, what this is not is just food distribution. I mean, we're good at food distribution, but for us, it needs to connect to the model for healthy living. So our patients who can end up getting food that would be prepared here at Grace St. Luke's or in somebody's own kitchen, how do they then engage with our health coaches a better way to live healthy? This is an over-the-top, fabulous idea that we're already doing it. So living in the food pantry know this, but we started during the pandemic when just giving out food was no longer an option, and your guys came to us, and we started working on a way to make this happen, and by God, it's working. But the issue now is how do we grow it? And I think there's an enormous opportunity to grow it to be something very big. Now, church health has always been about the faith community. When I first came to Memphis, the idea of going to church health for me was, who cares what the faith community is you're working with? Paul says you see through that glass darkly. What I think that means is that none of us have all the answers. We need each other in every way possible. So Jewish, Christian, Muslim, Hindu, I don't care. So when I first came to Memphis, looking for the first dollars to support our work, I went to the most obvious place for funding, a Jewish family foundation. So it was the Plow Foundation that gave the first dollars to church health. Well, why can't we do this together again? And build something that is very big around distributing frozen food, along with connecting people with a model for healthy living. We are already doing this. But I think we're at a point right now to figure out, okay, how do we make this bigger? How can we really impact not hundreds of lives, but thousands of lives, tens of thousands of lives? We have the pathway through church health to do this. And for me, what better healing ministry could the church have? And how do we work together, arm in arm, over the next few years to develop something that's really powerful? That's what I came to tell today. So, sorry, I haven't been feeling that well, but I'm good. So let me just stop right now. Anybody with questions?
I have a question. I was wondering, you have a relationship with your patients that you can have this holistic approach, and it seems like that's where your limitation might lie, because I can see how you could distribute food more broadly through other outlets, but how would you also attach this model with it?
Good question. But you heard me say we have 80,000 people we take care of, right? I'm good to start there. I mean, I think, I totally hear your question here, but we need to go where we have, I believe, a controlled patient population we're working with, that we can then be evaluating what we do. I mean, the thing that drives me crazy about the church is we just do something and pat ourselves on the back saying, what a good boy or girl am I? Without actually evaluating, did I make a difference? Did I make a difference? So just because we gave people food doesn't mean we help them be healthier. So that's my thinking about how we would go about doing this. And we need to walk before we run here. Let's figure out how to do this and do this well, and then we'll develop a path of growing it bigger. Yeah. So that's just how my answer to that is.
These people that receive the meals, do they have a place to cook the meal? Housing is so critical.
Yeah, that's a good question. I mean, again, what church health does is take care of the working uninsured. So, we're not focused so much on homeless. MIFA and others sort of have that down. But we're working on people who are trying to get to work tomorrow and feed their kids. Yes, for the most part. I mean, if they're not, it's a small number if they don't. I mean, Memphis doesn't have a huge problem with homelessness. What we do have is a huge problem with inadequate housing. But I don't know hardly anybody that wouldn't have access to the microwave.
My name is Laura Gettison. Welcome to them. We're glad you're here at Grace St. Luke's. And I have the honor of working with Jerry and Amy and many of the others on the food pantry teams. And my understanding and our understanding right now is that we are one of very few, but hopefully more, teams and faith communities that are working to make these meals, these healthy meals that can be microwaved or cooked and such. How can Grace St. Luke's work with you all to expand that into the wider community, particularly interfaith? You talk about different interfaith communities. My understanding is right now we're the one that's doing it, which we're proud of, but how can we help make it go even broader and be a part of that vision?
Well, I'm not selling you a fait accompli. I mean, I'm selling you something that I think we've proven on a small level actually can work. So we need a serious effort to figure out how to do it. It's going to cost money. I'm prepared to go raise money for doing this stuff, but money follows ideas. We need to come up with what are the good ideas here, and then let's go do it. So there's a little thing. So Hugh works in conjunction with something called IHI, the Institute for Healthcare Improvement. They introduced us 20 years ago with a way of beginning ideas that are called PDSA cycles, so Plan, Do, Study, Act. So what we would do is, let's do this for 5 people. Let's go figure out how did it work for 5, and then let's evaluate how we do it. And then let's go do it for 25. And you're going to keep going through this cycle. So 5, 25, 125, 625. This is how you grow something to scale. So what you don't want to do is, let's go sit and think about this for a year. Churches are good at this. And then we implement it and, oh my God, it didn't work. At which point we just wasted a year. These PSA cycles can actually get you where you want to be in a very short period of time. But you have to be willing to just put your ego aside. And if this wasn't a good idea, then we're going to kill it. Which is, as long as it's only 25 people we're working on, then I don't care. You wouldn't care either.
I had a surgeon, Dr. Stan Smith.
I'm sorry, what?
I had a surgeon named Dr. Stan Smith.
Yes, ma'am. I know Dr. Smith well.
And he always said that he had the education and the experience, but only God did the healing.
I missed the last part. He had the education experience.
Only God did the healing. He has the experience and the education, but only God does the healing.
No, I'm right there with you. Yeah. I mean, things like that need to be our motivating factor around whatever we do here. But this issue of evaluation, y'all, is really important. Churches are exceedingly good at patting themselves on the back and saying, what a good boy or girl am I at? Am I doing this? No, we gotta, how do we make this better? Church Health's been doing this for 35 years. I see this as a major move for Church Health. We have built credibility over 35 years for doing this work. I'm ready to put our credibility on the line, and let's go figure out how we do it. And we're going to mess up. I'm sure of that. But I also think this idea is powerful. And I mean, how much is this not related to the gospel? And what are y'all getting ready to go do? I think you're going to have communion, right? The body and blood of Jesus, bread and wine. This is right down our alley of what we are called to do. So how do we take that outside of the walls of the church? This is how you do this. And I also think if you do it well, it can have an evangelistic outcome. You know, people who might never have ever thought about going to Grace St. Luke's might say, who are these people who gave me food? We're going to check it out. I think it's possible.
Gathering that it's really maybe training people or introducing them into better nutritious ways to eat, right? Changing their behaviors, not just giving them food, but
Right.
changing their relationship with food.
Yeah.
Can you effectively do that later in life, which I'm perceiving is who's receiving these meals? Is there an aspect of this where you're getting people younger with the idea being they eat better, they're less likely to one day be a patient for church health or have less medical needs?
Yeah.
So is there an educational component of this in changing their relationship with food at a younger age?
Yes. Yeah, I mean, all of, you know, from soup to nuts. I mean, we have to have a thought out plan and idea from childhood to being 90 years old. Again, we have to be willing to kill an idea that we thought was great, only our evaluation of it says, oops, that didn't work. But in the beginning, we want to keep it small enough so that we have enough validation that, hey, this idea means something. Which is why, I mean, we want to start working with y'all if y'all are interested in this. Sorry. And then, you know, go to other churches. You know, we do it with one church, Grace St. Luke's. Let's now go do it for 5 churches. You know, we got to do it for 25 churches. Every time we grow this idea along that path, I assure you, it's going to interject some difficult problems. But bring it on. We're worth doing it.
Yeah, my question around the distribution of the frozen meals. Is the model more of a centralized model, you know, with the onus of picking the meals up on the people you're serving, which might have some issues with transportation, time, or do you put it on home delivery, which has its own issues with coordinating massive amounts of volunteers and a whole more costly. What does the model look like?
So are you volunteering for the distribution committee? Not for a moment think this is easy.
No, well, no, I didn't mean that.
No, I mean, get my point here is that, no, we have not figured all this out. Again, we have figured it out on a very small path, but our next step, you know, if we bring in 4 other congregations, you know, maybe y'all don't like them. You know, maybe they don't like you. And how do we solve that? But you, I think, begin by solving it by saying, hey, we're playing the same game.
What do you think is going to work? Do you think more of a centralized model or more of a delivery model?
Yes, I think that will work. I don't know. I don't know. You know, to the point about, you know, engaging patients who have a different mindset than me, I'm not going to just stand here and say, oh, I understand how this works. You know, I've been doing this for 35 years. I get it. I don't get it. You know, we need to figure out how we, before we get it too big, have addressed all these smaller issues. And I think it'll be fun. You know, I think it'll be really fun.
Well, actually, I just wanted to share something in response to your question about the education piece for nutrition. We have one of the patrons that's receiving frozen meals has diabetes, and that individual was counseled by her physician on what a healthy diet was, and she called to receive the frozen meals, and one of the things that she said was so important to her was she had a child who was also obese, and she didn't want the child to follow the same, you know, the health problems that she had experienced in her life. And so not only is she picking up frozen meals for herself, but also for her child. And the child loves the healthy meals. And so that's a way of prevention is huge. You want to prevent before you get to morbidity.
Yes, that's a great example. I mean, there's just so many ways we have to try to anticipate, but we won't anticipate it. But we want to get to where that issue for that child is something we're working on now, as opposed to we're working on 100 different problems that are similar to that. And that's a recipe for failure, for disaster. Working with volunteers, y'all, that is so hard. But again, I believe we can do it, and I believe it is central to the gospel.
Well, Scott, thank you so much for being with us today. And also, as Scott still will be with us, I've asked Jerry Hudson, who is actually the leader of our parish initiative, to share a bit more about how some of these logistics and things work. So if Jerry will come up, and let's give Dr. Scott Morris a round of applause.
I have a new book. I know you were expecting that. So Care, How People of Faith Can Respond to Our Broken Health System. If you're interested, so there are 90 clinics around the country that have used Church Health to model themselves after us. If you're interested in this, I'm going to leave a couple of books up here, but you can get it at Novel or wherever you can buy a book. I don't know where you can buy a book now. All right, great. Jerry, thank you for your help. So Jerry's been our main person we've been working with.
Thank you, Dr. Morris. To answer your question about the how it kind of works, the model right now is that we have 11 cooking teams at St. George's, almost 90 volunteers. I'm sorry, St. George's is where I came from in Clarksdale. At the Grace St. Luke's, and almost 90 volunteers cooking, 2 teams a week. We cook, each team cooks 30 containers when they cook, which feeds 2 people per container. So we're cooking 60 containers a week, which feeds 120 people. Church Health comes and picks those up from us on Tuesday mornings. They take them back to Church Health, and they distribute them to their patients a healthy meal. And in the process of trying to teach them how to eat healthy, they are all these meals, we get these menus from Church Health. They are all low sodium, low fat, low sugar, very healthy meals, very tasty. We've tasted all of them. All of the patients that we have connected with that eat these meals say every one of them are absolutely delicious. So the dietitian that Church Health has does a great job of putting these meals together, and not only are they healthy, but they're delicious. So it's something that the patients like, and I think it can grow. So right now, 60 meals is 120 people a week. Out of 80,000, that's a drop in the bucket. And so it would be nice if we could grow, but we've committed to helping Dr. Morris work with him on his model to grow this with other churches too in our community and make this a community-wide endeavor, church-wide endeavor. And so we're proud to be associated with Dr. Morris and Church Health.
Thank you, Jerry.
And I'll just say, connected to that, that it is, we are a part of our vision for the parish. Part of it includes healing. Healing is actually a part of who we say we want to be at Grace St. Luke's. And so I give thanks that the offering that the food pantry has, that More Than a Meal has, that our outreach and social justice is all a part of healing work collectively. I think it would help those who are in the room. Several people who are here are on a food pantry cook team, just to give others a sense of, and it's also a way to ask that person about the process. If you, wherever you are, will you just stand if you're on a cook team? If you'll just stand up for just a moment. So thank you for them. And then if you find them around, if you'll ask them more about how this works, that's one way to increase our participation. But what Scott Morris is saying is that our faith is rooted in healing. I mean, that's just what comes with the gospel and comes with our baptismal vows. And this is one of the ways that we're doing that. So I'm just glad to see us. And the question about what can we do is to encourage others. Is that this does take on, and it can encourage others to try it And maybe our model is one of the examples that others will find that's something that they can do in their own spaces. So with that, again, we are grateful for Church Health. Church Health has made a significant impact on the Memphis community in a lot of different ways. So with that, again, just a round of applause for Church Health and Dr. Scott. Go in peace to love and serve the Lord.
Thank you, God.
Yeah, that was perfect. Just to kind of set it up and get context. Because this is like a lot of churches.